Hi, I'm Lilly Neuman, host of Viewpoint. Viewpoint's mission is to bring you shows that are on topics that affect us as families and in our community, along with my co-host Susan Salomone, Executive Director of Drug Crisis in Our Backyard. Today's guest is Paul Urbinelli, Director of Evaluation and Referral at St. Vincent's Hospital. Welcome, Paul. Thanks for being here.
How you doing, Lily?
Hi, Paul. Nice to meet you.
Nice to meet you, too.
So St. Vincent's Hospital is behavioral health, one of the largest, I think, in the tri-state area for behavioral health issues, mental health, and substance abuse.
Yes.
You know what? We wanted you on the show because so many people now are accessing services, I think, because of the opiate epidemic and the crisis, and families are finding themselves. How can families prepare if they have to come into St. Vincent's? How do they prepare for that?
It's a lot to think about, especially when you find out you're dealing with a family member or yourself to come in to St. Vincent's for the treatment. Well, first of all, what St. Vincent's offers is we do substance abuse treatment for all levels. We do inpatient and we do outpatient. And so that's really the first step, to sort of think about what you're thinking of getting into treatment for. And then really you just need to show up. Usually we can navigate all the other stuff that comes along with it. But most important thing is coming to St. Vincent's and asking for the help. You know, it's always good to bring identification with you and, of course, insurance if you have it. But we always offer all the solutions and different ways we can try to help you if insurance is a barrier.
Right.
But yeah, really, it's just getting the person to come to St. Vincent's is the first step, or calling us, because we do offer our phone lines are 24/7, and our admission process is 24/7.
Right. And they can just walk in. You don't have to worry about an appointment.
No.
And people don't realize that. It's behavioral health. I know when you think about medical hospitals, it's 24/7. But they can walk into St. Vincent's also. And you also have the crisis team.
Yes. We do offer the crisis team for Westchester County residents, and they can get involved with any Westchester County resident. They do serve more of the mental health population,
right.
But as we all know, that mental health and substance abuse are hand in hand a lot of times. So as long as there's some mental health component, they can get involved with someone that's having substance abuse problems.
Do they have to be diagnosed with a mental health? Do they have to have a diagnosis, a mental health diagnosis, in order to be seen by the crisis team?
Not a diagnosis, but have some issue related to the mental health as well.
So they could come in and say, I have anxiety and I'm taking Xanax?
Yes, and that would be appropriate.
Okay.
Compared to just someone saying, I only have problems with alcoholism, but no depression, no anxiety,
right.
Which is rare, because like a lot of times things go hand in hand, but if it's strictly substance with no mental health need of treatment, then the crisis team unfortunately wouldn't be an option.
So what is the crisis team?
They're a mobile team of clinicians and one psychiatrist that serve Westchester County residents, and they're a 6-day-a-week program, Monday through Saturday, and they operate from 9 o'clock in the morning to 9 o'clock at night. And what they do is they can either, you know, it starts off with just a call to them.
Okay.
And once you call them, they'll either, depending on the situation, they can either have the patient and family come to St. Vincent's for the evaluation. They can go to the patient's home.
Okay.
Or they can, if it's such a emergent situation where family feels uncomfortable coming to the hospital and the crisis team feels uncomfortable going to the home, they can get emergency services with police to bring the patient to St. Vincent's or a neighboring hospital to get the appropriate help.
Is it a large team?
It's expanding, yes. It's one psychiatrist and about, I'd say approximately 8 clinicians.
Oh, okay.
That rotate shifts, you know,
All right.
from 9 in the morning to 9 o'clock at night and Saturdays.
Okay.
Yeah.
And also they go to schools. I know
Yes,
that schools have called. If there's an emergency going on in the school, they'll call. And St. Vincent's also has mental health programs.
Yes. They're very involved with the schools because, as we know, it's good to start young. And they're very connections, a lot of resources. So if St. Vincent's can't be an answer of treatment, they have a lot of connections in the community to get people linked up with.
Okay. So now when you said that people could just come to the hospital and say they need a bed?
Yes. For, well, there's, you know, at St. Vincent's, again, we're mental health and substance.
Right.
For substance abuse, we're 30 inpatient beds.
Okay.
Inpatient rehab beds. We are a non-medical facility, so we're not a detox.
Okay.
For some substances.
All
but
right.
for substances that don't require detox, we are an inpatient rehab. But unfortunately, for the people in the field of treatment, there are barriers for inpatient. Inpatient is not always the first answer of treatment for someone struggling with substance abuse.
So how do you figure that out?
The clinician or the doctor speak to the patient, and they, through treatment programs of previous success and what patients seem to do better in through the course of the time, and what treatment programs have learned and tried to maneuver and change, is that they see what the patient's done in the past, what the patient's doing now, and that sort of starts off what the treatment will be. And then
that's how they make their treatment plan?
Yeah, that's usually the start off. There's a lot that goes into it. Unfortunately, insurance and finance with substance abuse treatment is also a part of the decision also. It's something we don't really want to talk about so much because we hate to put insurance as a barrier to treatment, because we want to get everyone the help regardless of insurance help. But with substance abuse, there are different rules that have to go by with the insurance. Unfortunately, it's not the same as emergent medical care or emergent psychiatric care.
Right.
But however, you know that, I mean, Lilly, that mental health and substance abuse, there's a parity law.
That's right.
That it has to be treated as any other medical condition.
Unfortunately, insurance companies are still able to find the loopholes to say that they can't use the word medically necessary, but they do find loopholes. They can't say fail first anymore.
They can't say fail
first.
first.
They can't say fail first,
Yeah.
but they have other loopholes that they use. They use
Like
a
what?
language. Don't they? Do they say medical necessity?
They just say patient's not appropriate really for this level of care, and they'll give a recommendation for the level of care that they want to ideally pay for.
That has to be substantiated by an intake.
Yes,
right.
Like we're doing a full
assessment.
Screening.
I think screening.
Yes, we're doing our screening with our hopes of our recommendation. Our recommendations are never based on the insurance company or what someone's coming in with.
Right.
We're making our clinical recommendation for the best clinical success for the patient.
And I think the problem is that the clinicians can say the best thing is inpatient. Insurance companies are still finding loopholes. And I think as long as the insurance companies are finding the loopholes and able to get away with it, it's us, all of us together standing up with legislation and saying, no, we're not going to allow this to happen. That's why they got the parity. It's people just have to continue fighting.
Right. Well, actually, the Attorney General has a hotline that can be called if someone is denied insurance or denied an appropriate level of care of insurance or an appropriate level of stay. Unfortunately, I don't have that number on me, but that number is available on the Attorney General's website, and it is an 800 number, and there have been companies that have been sued.
That's right.
And for inappropriate levels of care and not long enough levels of, staying long enough. So Eric Schneiderman is definitely on the side of the consumer here.
Right.
And that's where it needs to be.
He really is on the side of the consumer. So we're happy about that, because I think this is something that is just going to take a long time to change.
Right.
The reality is you've got people going into places like St. Vincent's for 5 days and cycling out, relapsing, and coming back after, if they're lucky enough to come back, if they don't pass away.
That's right.
Or they stay out. They don't just go out. They go out and they stay out there for 2 years.
Right.
And then they come back. And it's costing the insurance more money than if they would just pay for it up front.
That's right. And we all know that treatment, has to change. That has to be longer lengths of stay. That they just can't do 30 days if you're lucky and then leave. An outpatient really has to be, especially with the opiates. Outpatient program just can't be 3 months, 6 months. It's got to be almost a year. I mean,
and not all in a hospital for a year, but
outside,
in transitional housing and programs that are different pathways. So for
Right.
people to find the thing that works
Right.
for them, like maybe working with clay or meditation or painting
Right.
or things that are going to help them find their passion. And, you know, we're nowhere near that.
We're nowhere near it. We're nowhere near it.
That's the one beneficial thing with St. Vincent's is that we are not just one level of care. So if we can't always, depending on the recommendation, get the person into a level of care because of something that we don't really like to talk about, insurance, we offer the alternative level of cares that the insurance probably would pay for at St. Vincent's. So we could still offer treatment for the person.
Which is?
Maybe an intensive outpatient program or even just outpatient.
Or day rehab.
Yeah,
5 days a week,
yeah.
9 to 2.
So
day rehab.
what is that day rehab?
That's where they go all day. They go
Group
from
treatments.
groups, individuals, but it's all day treatment from 9 to 2, 5 days a week.
So where does that fall in the levels of care? I know we have OP, IOP.
Okay, so it would be day rehab, which is 5 days a week from 9 to 2.
Okay.
Then you have IOS, intensive services, which is 9 hours or more, so it could be 3 days a week.
Okay.
And then there's clinic level, which is an hour and a half, maybe once a week, 2 times a week, 3 times a week.
Wow, so that 5 day a week, that falls between inpatient and IOP.
Yes.
Right, because it's outpatient, but it's all day. So
It's all day.
So if someone goes inpatient, then they should go to day rehab,
Right.
and then they should go to IOS, which is intensive level of services, and then to clinic level.
Right.
That's the best.
That's the best.
That's
Then
just-
maybe you'll see some
Right.
some people really holding on to
Right.
sobriety.
Well, that's the thing. It's continued care. So it's the inpatient to really remove the person, but the success is the continued care of treatment and support and community support, even after the treatment programs are finished.
That's right.
There's ongoing, lifelong community support that you have to be involved
Family
with.
support.
Yeah, family
And
support.
you have to
You
have
always need
families.
that.
You know
yes.
that? You send someone home who's come from inpatient, is going to outpatient, let's say day rehab, they're getting treatment, they're changing, and sometimes the family system that has spent all this time navigating the addiction and the personalities and the behaviors of the person who suffers from this disease, they don't have those issues any longer. This person's changing, but the family system hasn't changed. They don't know what hit them now. You
Right,
know?
and they don't, and that is not good for the person who
Not
is
good for the person
trying to
recovering.
get better.
That's right. That's right.
So how many people, you know, like of 100% of the people that come through your facility, how many people wind up going through that entire continuum of care?
Well, that's really the goal, is if someone is to start off inpatient, is then to do the next level of care, either a day rehab or an IOP, then step down to maybe just a clinic level outpatient, and then to community support. I mean, you'd really want everyone to do that course because you need that high intensity, then back down a little bit, and then just the continued support of all the skills you've learned, the trigger recognition for the substances, and it's ongoing because, as we all know, it's a lifelong battle. So just a gap in treatment could, get your defenses down and cause you to relapse. So that's the goal of every treatment provider. It's to set that next level up for when the person's getting ready to transition out of their current level. Unfortunately, lack of programs in other facilities is not so abundant, and unfortunately the patients, I guess, get overly confident a lot of times where they feel they don't need any more,
Right.
and don't want to be, participating in groups anymore, and feel it's just time to go home and they'll just talk to their family. And unfortunately, as treatment providers, we all know that's never enough.
Right. And, people think they're better. I'm better now. I can do this. I can handle it. I don't need to come to day rehab. I don't need any more program. I don't need treatment. Then they go back to the routine, and then it just after. And we all know relapse happens way before people pick up.
So I have a theoretical question here for you. We all know that this is a disease. There's no.
No question.
We agree with that?
Yes.
So why is this a disease where the person that has it is unwilling to get the help they need? It's not like any other disease. It's not like cancer. It's not like another disease where you would welcome the help.
Right.
like cancer patients, they go on for treatment for years and years, for tests, make sure the PET scans, make sure there's no cancer in their body. What is it about this disease that causes people to think that they don't want any more? They've had enough. What do you think?
I think it's because it's inherently, all these years, is a stigma. It's a moral issue. If you had enough guts or self-control or whatever it is, you could do it on your own. It's asking for help. I think there's a lot of things. People don't look at it as a disease. Even now, people say, well, you know what? I heard someone say, well, that disease concept, I'm not buying it. It was from a person in the field. I don't think it's really a disease. I'm like, what, are you kidding me? That just sends us back all progress that we've made by looking at it that it's willpower. If you tried hard enough or you wanted hard enough. And also I have to say, I think part of the treatment providers, you tell me if you came in for cancer or a knee injury or something, what didn't you do right this time? What didn't you do? What didn't I do? I got cancer. What do you mean, what didn't I do? But that's what we ask, right? What happened this time? What's going to be different this time? Have you ever been to a doctor for a health issue and they go, what didn't you do? What's going to be different this time? What would you do if your doctor said that to you?
Exactly.
And I think we have to change also the way we approach it and the way we talk to people, because I think we put them on the defensive. Even though we know it's a disease, we put them on the defensive that there's something wrong with them, because we're squarely putting the responsibility on them. And if you had cancer, you don't do that with a person.
Yeah, I've heard clinicians say, so you're back again?
Right. So
would you say that if someone had cancer
No.
and it showed up on their PET scan?
Right. Or
so you're back again.
So you're back again. What didn't you do?
It is really crazy when you think about it.
Yes, it's an education starting with the treatment providers that need to start. And as Lilly said, in this country, it's just come about that it's starting to be recognized as a disease and not just, failed willpower.
That's right.
Or,
but I think all of us, we haven't all caught up to
character
that.
defects.
That's right. It's not a character defect.
No,
it
isn't a character. But it is, I believe, with all that said, I believe that for some, they don't want to let go of the drugs. They don't, as much as they do, they don't want to.
Well, yeah, speaking from a non-clinician viewpoint, people have addictive personalities, unfortunately, and sometimes it's just that's their addiction, and they really can't. It's going to take a lot of treatment and to really realize it's an addiction that's going to eventually probably end you.
But you know what else? If you've coped a certain way for so long, and you go someplace, a program, wherever, and you take away that thing that I've coped with since I was 12 years old, and now I'm 30, 40, 50, 60, what are you going to replace that with? Oh, keep coming back, it works if you work it. I got a bazillion slogans. Right. Let live and let God, let go and let God. I mean, tons of slogans, but that's not replacing what I've missed since I was 12. I don't know how to socialize. Right. I don't know how to talk to people. I don't know how to deal with my anger. I don't know how to do anything.
I still have anxiety.
I still have anxiety, and you're taking away the thing that works.
And that's a good segue, is that where mental health and substance go hand in hand, a lot of the addiction is self-medicating mental health issues person's having that they maybe never wanted to talk about or really thought it was a real issue. Oh, everyone feels down, so that's why I drink. Who doesn't feel down after working a long day and maybe, had a bad day? That's why, but maybe it's more to that. And that's why you should seek, a professional to see if you are self-medicating and it's not just, I'm drinking because I like drinking, I'm drinking because to forget about something maybe.
And you know what? I hear a lot in our support groups, because the parents that speak there, the kids that have gotten involved in this, they lack self-esteem. Like, not after they get involved in it, before they got involved in it. They're lacking self-esteem. And for whatever reasons, they didn't feel, they had no confidence. And I could see that in my own family, because I had 4 children, and my first one got sick and passed away. And he was lacking self-esteem from when he was born, I believe. I believe from when he was born.
Right.
And the other ones, were not like that.
Right. They cope better or differently.
They cope better.
Yeah.
That's it. And how do you know?
It has so much to do with that. So,
right.
so I mean, this is such a complex
That's
thing.
right.
There's
Yes.
so
That's
many
right.
parts
That's
of
the
it.
best way of saying
Right.
Yes.
Very complex. It's not one answer.
Yeah.
And I think that's why treatment has to cover everything.
And one thing that works for one person is not going to work for the next person. It really is what you're going to get out of it, not just being there, but what you're going to receive from it and put it into your life to be successful.
And I have to say, with cutbacks and no money being put into treatment and treatment places closing, how do we then give people the necessary services to individualize everybody's treatment so they can be happy, healthy, and whole and successful? Because we accept 85% recidivism rate. There's no other disease that we could say 85% people just keep getting relapsing, and it's almost commonplace, and it shouldn't be.
Yeah,
it shouldn't be, and we have to do something about that.
Yeah.
Really.
So what do the programs look like at St. Vincent?
So, you know, again, the inpatient programs, a 30-patient inpatient unit. It's
Is it co-ed?
yes, it's co-ed.
Okay.
It's a male wing, a female wing, sort of like a college dormitory feel with a nurse's station.
Okay.
You know, cafeteria, group room. You know, they do activities, but a lot of the time is spent in groups.
So what are the groups like?
They're therapy groups, treatment groups. They do art groups.
Okay.
There's a good mixture of groups. There's also mental health groups if needed, and the patient wants to be part of that as well.
Are the groups mandatory?
No, but if you're not attending, you will be asked to not participate in the program anymore, because the whole point is to be participant in it, not just be in your room to say you're at a rehab.
Do they have an exercise group?
They, you know, unfortunately, we don't have a gym where we have like, you know, gym equipment, but they do go outside. We do have basketball courts where during the nice weather they're able to go outside at least to get some air and exercise a little bit.
Okay.
And then there's the partial program.
Yeah, and then we offer, you know, then we have the day rehab, which is 5 days a week, 9 to 2.
Yeah.
And that's strictly group settings. Again, mostly substance abuse is always going to be in a group setting, which tends to be the more successful way to approach for it. And then same thing with the outpatient and the IOP. It's group settings, just less amount of times, as Lilly talked about before.
And then you have partial.
And then we have all mental health programs as well. We have acute mental health inpatient units. We have the partial level of care for mental health. That's sort of similar to the day rehab. It's a 5-day-week program, 9 to 3. That deals with just mental health. And then we do offer clinic services where you get a therapist and a psychiatrist for your mental health as well.
Do you do medication-assisted treatment?
Yes. You know, every program, medication is an option if the patient is in need of it and is agreeable and the doctor
And they do
feels they need it. Yes, we do Suboxone. We don't start Suboxone, patients on Suboxone, but we can intake any patient that's on Suboxone and continue their current dosage.
Okay. And what is like an average dosage for Suboxone?
You know, I'm not a physician. I wouldn't want to get into that and
All
give.
right. How about Vivitrol? Do you do Vivitrol?
No.
No.
But I really, any
Okay.
type of medication I would leave for the doctors. I mean, I know most of the answers, but
no, we don't do Vivitrol.
You have to know all the answers.
You have to know all the answers, Paul. That's why we had you come here.
The main thing too is, unfortunately, with St. Vincent's, we're not medical, so a lot of the things that might be the first steps of maybe for withdrawal or something, we need that sort of taken care of first before they can come to us.
Do you recommend I know there's not that many detoxes.
Yeah, that's the other unfortunate thing with the increase of opiate abuse and alcohol, because those are the two main substances that require detox. There are so few detoxes left in the county. St. John's, Riverside, and Yonkers is the only advertised detox left in Westchester County, and they're a great facility for that. Other than that, it's sort of, if you're in a medical crisis, you can also get that same help. But as we all know and learn, ERs will very not like to take you in for a detox unless they really feel you're medically compromised.
Right.
So it's rough out there.
Yeah, it's very tough.
It's hard out there.
What's the problem with the detoxes? Why aren't there more?
Funding, probably.
Yeah,
Funding,
probably
money.
Because it's such a short treatment, they probably look at it like, why should I offer it? Because you know, the patient's only going to be in less than 5 days.
Right.
And that's just my answer.
Yeah, no, I know.
Yeah, that was all. I was wondering what your opinion was. But Putnam Hospital used to have a detox. They closed that. Well, Arms Acres has a detox, but that's Putnam.
Right.
And
Nyack has a detox.
Nyack has,
but that's Rockland.
Yes,
that's Rockland.
And St. John's in Westchester.
Yeah.
And St. Christopher's has a detox.
And St. Christopher's.
Yeah.
So that's
and Greenwich in Connecticut.
Oh, Greenwich,
Yeah.
Greenwich Hospital
in Connecticut.
has a detox.
They're also
Okay.
a detox.
Do you have to be a member? Do you have to be a resident of the?
No, they're great. They help anyone.
All right, I didn't know about
They're
I didn't know about
great.
Greenwich. Good, that's good to know.
So, Paul, I love this guy.
Me and Lily have worked together.
How long have you been at St. Vincent's?
I'm going on 9 years.
9 years.
Yeah.
Oh, okay. Because I was there in 95, and then I left and came back in 2006.
Yeah.
So I was
And,
there from 95
but when I
to
started
2000.
off, Lily was our...
Where did I work?
You were in Excel. That was when
I
you were
was
the
in Excel. That's
She was
right.
the
That's
coordinator
right,
of
for
our
Excel, working
adolescent
with
program.
adolescents. That's right.
So the
That's right.
adolescent program is outpatient, right?
Yes.
Yes, we don't do inpatient substance for adolescents.
Okay.
17 and younger, ages 13 to 17, we do offer, like Lily said, IOP level of care and outpatient level of care for substance abuse, which is called the Excel program.
Right, for adolescents.
It's an excellent program.
So they come.
We actually do the schooling in our programs.
All right.
They do the school piece.
We do the schooling and we do the treatment.
So they
the
come
kids
every
won't have
day?
to go to school
They
to
come
do
every
their
day.
schoolwork, and then we'll get them the treatment they need to.
Okay, that's good. That's a good program.
So it encompasses, because a lot of kids aren't doing well because of the drugs. School. And
Obviously.
that's a huge,
How many
huge
slots do you
piece.
have in that program?
You know what? It fluctuates.
We very rarely turn anyone down for that program.
Yeah.
We always can get
Adolescent.
someone in.
Okay.
The at-risk kids. So you know what, Paul? I wish we could see it goes fast.
Yeah,
I
it's
wish
great.
we had more time. You'll come back and visit us
Always.
again.
I'll be looking forward to it.
Thank you.
All right, it's nice meeting
It's
you,
very
Paul.
nice to meet you too.
Thanks for joining us.
Thank you,
See you
Lily.
next time.